In today's session, we will establish the groundwork for everything that is to follow. We will explore what artificial intelligence really means in healthcare, and we will distinguish between the different types of AI systems, and we will understand why machine learning represents such a significant achievement over traditional rule-based approaches. And most importantly, we will discuss why this knowledge actually matters to your career and to your patients. And welcome to the first episode of Your Role in Healthcare AI and Be the Human in the Loop. And this is the first lecture in this series. Let me share why this series exists. And over the past decade, working in healthcare IT, I have observed a common trend. This is before even AI. Healthcare professionals, whether you are an executive, a physician, anyone, they really don't truly understand the technology. And in the world of AI, if you really want to be part and parcel of this world, you really have to understand the technology. And this series is designed to bridge this essential knowledge gap. And we're not here to, of course, turn you into programmers or data scientists, at least not yet. Because later we will actually design and train our own models, and you will learn being the human in the loop. Here, I'm going to give you the foundational understanding that you need to make informed decisions about AI implementation in your healthcare setting, to evaluate vendor proposals, and intelligently look at everything, and to position yourself as a knowledgeable leader in this rapidly evolving landscape of modern medicine. You cannot be left behind. Let me briefly introduce myself and explain why I actually am passionate about this topic. And I'm Dr. Umer Khan, and I've spent over a decade in the forefront of healthcare technology, developing mobile applications, setting up COVID-19 monitoring units. And my mission is pretty straightforward, and that is to bridge the gap between AI technology and practical healthcare applications. My focus areas span three critical domains, one as an AI implementation specialist, then helping healthcare organizations navigate the complex processes of integrating artificial intelligence into their clinical workflows. And this includes everything from vendor selection to staff training to outcomes measurements. And I also want to serve as a healthcare technology educator, and I have developed this curriculum and training programs to help healthcare professionals, whether they are doctors, executives, pharmacists, nurses, anybody I believe could benefit from this. Now let's start with this fundamental question. What exactly is artificial intelligence, and how should we think about it in relation to healthcare? Now, at its core, artificial intelligence refers to a system that mimics human intelligence through learning, reasoning, and problem-solving capabilities. But that definition, while technically accurate, doesn't really help us understand what AI means in practical healthcare terms. You want to think about AI as a digital resident or a junior doctor if you are in the US. Now, just as a doctor observes patterns and symptoms, laboratory results, imaging studies, patient history to make clinical decisions and recommendations, the AI system also observes patterns in data to simulate basically a similar decision-making process. Now, this is an essential distinction to understand. AI truly does not understand. Let me repeat that. AI truly does not understand medicine in a way that a human physician does. Instead, it simulates understanding through pattern recognition and statistical analysis. And we will go over some of that statistical analysis in the coming videos. And you can develop an incredibly sophisticated pattern matching, but it is still pattern matching. It is not aware. It is still pattern matching. It is not AGI, okay? It is not aware right now. So the strong word you need to know is that it mimics human intelligence. It does not act like it is intelligent. It's not actually intelligent. And it can have clinical reasoning, pattern recognition, and decision-making even under uncertainty. It can actually give you an answer. Hey, it may not be 100% correct. Now, it acts like a digital resident, observing the same symptoms and patterns. And the key difference is that it does not truly understand medicine. It simulates understanding through patterns. And this is why I emphasize that AI augments rather than replacing human clinical judgment. And the most effective AI healthcare implementation actually combines pattern recognition capabilities of artificial intelligence with the contextual understanding and the empathic nature of human healthcare professionals. And now that we understand what AI is conceptually, let's explore the two fundamental approaches to artificial intelligence in healthcare. One is rule-based AI, and then learning, machine-based learning AI. Understanding this distinction is critical because it affects everything from implementation complexity to clinical outcomes to ongoing maintenance requirements, which all you will be a part of. Now, if we go to first rule-based AI, and rule-based operates on an if-then logic. If this is true, then do this. So it's a logic that is programmed by human experts, but it is fairly basic. These systems follow explicit instructions that have been coded into the software. A classic example is a sepsis alert system. Now, the first I was exposed to a sepsis alert system was way back about 12 years ago when I was starting my residency. Now, this is that old. So we have come a long way, and we have already improved upon this to make it a much more robust system than we had at least 10, 15 years ago. Now, the system might be programmed to say that sepsis alert triggers when the blood pressure is less than 90. Now, this is, of course, simple to implement and easy to understand. Okay, the blood pressure went down, went below 90 millimeters of mercury. Now, this is very transparent, but the problem is it is limited, and it is really not complex and limited by the complexity of the rules. And as we know in medicine, medicine is fairly complex. Now, there are limitations because they cannot adapt to new situations that were not explicitly programmed, and they may generate false alarms in situations that don't fit predetermined patterns. So, for example, a patient whose blood pressure normally runs 90, this may not be a useful system. This may not be a useful AI. On the other hand, now we're going towards learning-based AI and more machine learning-based AI. The learning-based AI, on the other hand, represents a fundamental approach differentiation. These systems learn patterns. This is going to happen. Now, this is going to happen instead of just simply data. Instead of programming every single scenario, they actually learn patterns from the data. And we train these systems on large data sets that allow them to discover patterns that may not be obvious to human observers. Now, one example is predicting readmissions from electronic health record data, predicting readmissions. It discovers patterns in the data, adapts to new information. So this is the importance of having learning-based systems. And we will actually develop some of them later down in the program. Now, these learning-based systems for predicting hospital readmission might analyze thousands of variables from electronic health records, including not just clinical data, but also social determinants of health, medication adherence patterns, and even environmental factors, whether it is raining outside, it's snowing outside, it's a holiday, it's Thanksgiving dinner, it's Christmas, whatever. The system learns which combination of factors are more predictive of readmission risk. And what you can do, or if you are an administrator, you can see, okay, we are seeing these spikes happening because of these reasons, and it's going to repeat itself the next year. So they can plan accordingly regarding the resources, how many doctors they need, how many nurses do they need more respiratory therapists for for a particular reason. So all of this is much more valuable than just the rule-based AI system that we had previously. Now, the problem is that it can be a black box, and a black box in this situation is not a black box. For example, when a plane crashes and you're looking for the black box and with all the audio information, everything else. So in healthcare terms and in machine learning terms, a black box is that you are unable to clearly describe why it came to a certain conclusion. And that is fairly important in healthcare. So black box means that the decision-making process isn't always transparent and easily explainable. And this can be problematic in healthcare settings where clinicians actually need to understand why a system made a particular recommendations. And we'll dive much more deeper into these details. But in all honesty, both of these systems, the rule-based as well as the learning-based AI models, have their importance in healthcare, and the most effective AI implementations actually combine both of these approaches. Now, let me explain the rule-based AI a little further, and let me give you just a diagram over here. So the patient's vitals input signals, this is what you're capturing. Blood pressure is checked. Your blood pressure is less than 90. Yes, if it's less than 90. So you get a sepsis alert. The nurse is alerted. And this is the sepsis model. This is the model that's fairly straightforward and simple. It basically means that the logic is hard-coded. simple if-then rules. They trigger alerts based on predefined thresholds. And benefits, again, is simple to implement, transparent decision making, and predictable. You know what's going to happen exactly. The limitation is that it cannot adapt to patient-specific contexts, such as I mentioned, chronically low blood pressure, let's say in the elderly or people with end-stage renal disease. Their blood pressure could be low chronically. Another example could be that a young athlete might have a resting heart rate of, let's say, 45 beats per minute, which could trigger alerts for low heart rates or bradycardia alerts, even though that is completely normal for this individual who is an excellent cardiovascular condition. Now, this rule-based system doesn't understand context or individual patient baselines. So this is the problem over here. Now, this is precisely why machine learning approaches have become so important in healthcare AI. And they can learn these individual patterns and adapt their behavior accordingly. Now, let me just step back a little bit. So artificial intelligence is this big umbrella, and it has a smaller umbrella called machine learning. And within that umbrella is also called deep learning. So much deeper, much deeper into the mix, right? So let's look at this right now. Let me actually see if I can expand this image so you will understand this a bit better. So you can see over here that we're looking at artificial intelligence. That is this big blue circle. That is this big blue circle. And then you have machine learning. So artificial intelligence, the big blue circle. The machine learning is the green circle. And you have deep neural networks. This is this shaded area over here. So artificial intelligence, then machine learning, and then deep below you have deep learning neural networks, and we will go over that in this lecture as well. Again, machine learning is a subset of AI, the subset of AI that learns patterns from data rather than from explicit rules. It does not do rules, does not do explicit rules. And the healthcare data could be anything: EHR records, medical imaging, lab results, vitals, patient outcomes, so many things. It could be ED throughput, it could be staffing needs, anything could be part of this. Now, the clinical impact here is that it can predict conditions early, much before traditional methods. It can help you plan things out or manage the patient. Let me give you a concrete example. Now, we know sepsis, and people will look at the books and sepsis criteria. You have the WBC count, you have the heart rate, and you have other factors, right? The systolic blood pressure, etc. But nowadays, a system may learn that particular combination of factors. For example, those variables, as well as, let's say, a slight increase in the heart rate variability. The heart rate is going up and down, combined with a modest elevation in lactic acid, or a decrease in urine output, decrease in the urinary output, and a change in the frequency of nursing assessment. The nurse has to somehow go and see the patient a little bit more. All of this predicts sepsis development 6 hours before traditional criteria of sepsis. Now, this is where the goal is. This level of early prediction capability can be life-saving, and sepsis mortality increases significantly each hour of delayed treatment. So identifying at-risk patients before they actually develop sepsis, based on our older criteria, it can dramatically improve patient outcomes, reduce the amount of money spent on healthcare, increase patient satisfaction, and whatnot. I think now you see with this example what machine learning can really do to healthcare and improve everything from robotics to diagnosis to treatment options. However, it is important to understand that machine learning isn't magic. The quality of the predictions actually depend entirely on the quality of the training data and the appropriateness of the algorithms that are being used. And we're going to talk lots about algorithms after you learn these basic aspects. So garbage in means garbage out. Garbage coming in this way, it means garbage out. You will not have a good model. And it could also mean that a model worked on a different hospital or a different setting. It may not be working in your clinical setting. The model is probably trained on data from a tertiary care network in the heart of New York or San Francisco. However, you are in rural Arkansas or Oklahoma or anywhere else, that model may not necessarily work for you. So that's why you, the human in the loop who is in Arkansas, who is in Ohio or rural Pennsylvania, that's where you come in to tailor and target the AI for your needs, for your particular location. So this is where you, the human in the loop, is going to be coming in if you are in that particular situation. Now, let me show you two powerful examples of machine learning in action that demonstrate the real world impact that these symptoms can have on patient care and clinical outcomes. Our first example shows pattern recognition in imaging, in medical imaging, specifically for pneumonia detection in chest x-rays. And in this program, I'm actually going to guide you through developing your own model for looking at images, just not for pneumonia, but other medical lung problems as well. That's going to be part of this program. So stay tuned. Now, ML models have been trained on millions of labeled X-rays that can detect pneumonia with 91 to 93% accuracy. Now, this term labeling is very important. This is the beginning point of your data collection and your data. The data has to be good. Now, let's say I'm a radiologist and my friend here, Steve, is also a radiologist. I'm not sure if Steve is here. I'm hallucinating, just like AI sometimes. I think that is multi-lobar pneumonia. No, but Steve, the radiologist, says that that is interstitial edema. It is not pneumonia. That could be a problem. So when you are labeling, and this is very important to understand, when you're training an AI, you have to make sure that your labeling is standardized, that everyone thinks that that image is of pneumonia. It is not interstitial edema. Now, this is very important. Now, let's just go back to the lesson. Now, in the long run, if it is based on standardized labeling practices, then this could detect patterns that radiologists might miss or may take a little bit longer. And this can be done automatically. Now, this reduces diagnosis time and has been known to reduce diagnostic time by around 60%, accuracy by 90 to 91%, and reducing diagnostic time by 50%. Now, AI also trains by looking at all the pixels, and it can determine which patterns and learn from these patterns what is normal and what could be pneumonia or interstitial edema for that matter. Now, the second example demonstrates predictive analysis for hospital readmissions. We talked about that, and let's look at this right now. So machine learning data can integrate multiple data points from electronic records, from county records, from the environmental records, from weather.com perhaps, from your calendar of events for holidays perhaps, and local holidays and external holidays, everything, the positioning of the moon, the full moon, everything, it can bring it together and give you a readmission assessment and risk scale for, let's say, people for 30-day readmissions, because we know in the US that 30-day readmissions is being monitored and hospitals get penalized if you get a patient readmitted to the hospital within 30 days. Of course, there are lots of caveats. But let's just look at this, and machine learning can greatly help you figure this out. Let me see if I can expand this for you over here. So healthcare predictive analysis. So you are plugging in age, comorbidities, lab results, medication, vitals, and as I talked about, weather information, right? So is it cloudy? Is it rainy? What is it? Is it sunshine? What is it? And you get an AI prediction, and you can have multiple actions. You can have clinical alerts. You can adjust your care plan. You can work on resource allocation, and you can take preventative measurements. Let's say if you had a high score, you can do all of this based on putting all of the information into your machine. And the impact on healthcare outcomes and healthcare costs can be substantial. And hospitals using these systems have actually reported reduction in readmission rates by up to 25%. And this not only improves patient outcomes, but also reduces costs for both the patient as well as the healthcare system, especially given that the financial penalties associated with excessive readmission rates under value-based care models. And hey, why wouldn't you want to be a healthcare system that says, hey, our patients don't come back to the hospital, they stay well, they stay healthy, and they stay in the community? And now that we understand what machine learning can accomplish, let's explore the three fundamental approaches to machine learning, and each of which has its specific applications in healthcare based on the type of data available and the clinical outcome that we are looking to solve and address. Now, the first approach is called supervised learning. Now, it is trained on labeled data. We talked about what labeled meant, right? Labeled meant that it is mentioned what this is. This image is this. This lab work is this. So it's label data and again, medical image diagnosis. And this involves training systems with label data where we know the correct outcomes. Label means outcomes. Label, let me just write this down. Label means this is what outcome you are saying this has. This is pneumonia. This is heart failure. This is a lung nodule. This is a brain tumor, right? Just being very layman here. Now, basically, the machine guesses based on you are providing that these are blue squares and these are red triangles. You already provided this information. You have good data with you. In other terms, think of this learning is when a teacher actually provides the right answers during the training process. The teacher is providing you with the answers. The doctor is providing you with the answers. Now, the system basically learns to recognize these patterns. They learn that these patterns are associated with each category, and then it can classify each of them separately. And when it sees them again in real world settings, it is able to recognize these patterns. Now, unsupervised learning and unsupervised learning takes a fundamentally different approach. And it does by finding patterns and data without predefined labels. There's no labeling that this is heart disease or this is pneumonia, this is interstitial fibrosis. There's no labeling. The system analyzes the data and identifies natural groupings or structures without being actually told what to look for. It can identify different patterns. Now, to give you this example with this chart over here, unsupervised learning, you're not labeling them, but the data is still there somewhat. Let's take, for example, you have a diabetic population, you have an EMR, it has loads of information about diabetic people, and they may be taking insulin, they may be on metformin and not taking insulin, or they may be just patients being treated by lifestyle modification, right? So you have the people on insulin, you have diabetics on metformin, and you have diabetics who are being treated with the lifestyle modification. Now, you have not gone through all the details. You have not gone through the charts and separated out all the charts with patients only on insulin, patients only on metformin, and patients only on lifestyle modification. You don't know any of that. You know there are people like that, but you don't really know which people are like that, right? You have this whole information, thousands of medical records, and you throw this into your system, and voila, patterns are being discovered by your machine learning algorithm. Now, coming back over here, these people could be the insulin folks. These people could be the metformin folks. And these are lifestyle people. Your algorithm is able to detect and differentiate and make categories. Now, this, my friends, is what is unsupervised learning, where it finds patterns without labels. And this is an example of patient population clustering. And the benefit of unsupervised learning is that its ability to discover novel insights that were not anticipated by human experts, or you do not know about this. And it can identify patterns that might lead to new understandings of disease mechanisms, treatment responses, or patient risk factors. And you might win the Nobel Prize for medicine. Let's say, for example, you find diabetes type 4. Now, we know about diabetes type 1, diabetes type 2, and people do call Alzheimer's disease as diabetes type 3. Maybe you're able to find diabetes type 4 and also find treatment for those groups of people and win the Nobel Prize, right? Wouldn't that be grand? And pharmacists, this is how you might be discovering newer drugs that you never saw before. People in PhD, in big universities, in research centers, they're all doing this right now and trying to figure out how to treat your diseases through newer things that were not possible before this. Now, the third approach is reinforcement learning, and this involves learning through trial and feedback loops. Now, the system learns by taking actions, observing the results, and adjusting the behavior or doing a response based on those outcomes and whether it's positive or negative. Okay, let's say, for example, a patient with, again, let's look at sepsis, that blood pressure needs to be more than 90 systolic, perhaps, let's say. And if it goes below 90, that's a negative outcome. If it goes above 90, that's a positive outcome, or it could be any outcome that you have labeled into your system. And I'm going to give you an example of this in more detail. And the choice of all of these approaches that you may look to apply depends on the clinical problem, the available data that you have, the type of data that you have. It is labeled, is it not labeled? So a successful healthcare implementation actually will be a combination of all of these approaches, supervised learning approaches, unsupervised learning approaches, and of course, reinforcement learning. All right, now the recap for supervised and unsupervised learning. Supervised learning, as we just learned, definition, learning from labeled data. You have known outcomes. You know it is lung cancer. You know it is a meningioma. You know it is pulmonary fibrosis. And let's go to an example. You know that you are predicting if a breast lump is benign or malignant, right? You need to know if it's malignant or is it benign. That's important in healthcare. And of course, the life of the individual. And this is based on learning labeled mammograms, learning on labeled mammograms. The challenge happens, as I discussed previously, that labeling needs to be proper. Labeling needs to be very objective, that the same image or the same patterns should not be listed as something else by different clinicians. One image that is clearly a pneumonia should not be listed as, oh no, that is interstitial fibrosis. You cannot have errors in them. Your labeling needs to be consistent. And the challenge is that you do require expert labeling, but these labeling could be subjective. For example, 5 radiologists may give different interpretations of the same image, and that could be a problem. Or similar patterns can be labeled differently by different radiologists. That could be a problem. Then we have supervised, unsupervised learning, finding patterns with data without predefined labels, a clustering of patients with similar treatment responses or disease progression patterns. And the benefit of this could be that you can discover previously unknown patterns or patient subgroups. So this was a brief on supervised versus unsupervised learning. Now we are going to explore reinforcement learning and deep learning, and these are two advanced AI approaches that are pushing the boundaries of what is possible in healthcare. And this is through reinforcement learning and deep learning. And these represent the cutting edge of artificial intelligence applications in the medical setting. And as we discussed before, reinforcement learning learns by trial and error through feedback loops. And I gave you an example. And this image, you can realize an example right here in this image. One example could be optimizing ventilator settings, patient responses. Then you could have treatment optimization. You could look to optimize patients' diabetic regimen, their blood pressure regimen. A lot of these things. You can look to optimize their medication dosing and your implications in robotic surgery. So now in robotics, this is huge. And this is how robots are learning. You know all about Tesla robots. They were very flimsy and couldn't hardly walk early on. And now they can walk and run. You can see all the robots coming out of China. You can see Boston Scientific. Initially, they were not that good, but they learned through deep learning and reinforcement learning. They learned that you have to stand up, you have to walk, you have to get up. So the similar thing is happening in healthcare with robotics. How to suture, how to make this anastomosis, how to do this microsurgery without cutting a vessel, perhaps. So all of these are happening, and we're going to talk all about this in the program. Now, let me give you the sepsis example again. Now, in sepsis, the blood pressure is a big problem. So blood pressure would be low. And you want the blood pressure, you actually want the blood pressure to be, higher. Let's say, for example, the patient is getting vasopressors. So vasopressors are medication that increase a person's blood pressure. And people in healthcare, of course, will know about this. This is a no-brainer for them. So let's say, for example, the patient's blood pressure goes less than 90. This is a negative outcome. This will lead to increase in the dose of the vasopressor. This will lead to increase of the dose of the vasopressor, and hopefully the blood pressure may go up. And my friends, the AI system has saved the patient, and this happens every single day, every single ICU on Earth. that a nurse is going back into the room, back and forth, that the blood pressure is going up, blood pressure is going down, and then when the blood pressure goes down, the nurse has to increase the amount, the rate of your medication, your vasopressor medication. And if this can be done relatively automatically, then it will save a lot of time and headache for the nurse and possibly better outcomes for the patient, because it could happen the nurse is busy with some other patient and the blood pressure is dropping, but there is a need to adjust your vasopressor. Hey, increase that norepinephrine drip, increase the vasopressin, whatever you are using. And this could happen within seconds or even minutes, when the system has analyzed that, hey, yes, the blood pressure is going down, let's work on this, instead of giving out an alert that the nurse may not see for the next 10 minutes or somebody else may not see. And this will happen immediately, and patients' outcomes will be much better. Now, deep learning, my friends, deep learning is the holy grail. We talked about artificial intelligence as the big umbrella, then machine learning, and then deep learning. It's not deep that it's the deepest, and however, it is also very special. Now, this uses systems where there are neural networks with many layers of processing, many variables are being looked at, many labels are being looked at, many computations are happening in very complex patterns. And this can result in processing and identifying increasingly sophisticated patterns. It can look at numerous variables that you may not look at. Specifically, let's say a junior doctor who does not have the skill right now, who does not have the insight that a senior physician has. A senior physician will just walk into the room and say, okay, this is happening, do this immediately right now. A junior doctor may have to look at the lab work, the labels, the vital signs, they'll look at the medication list. A senior doctor will have been there, done that, and has understood what needs to be done immediately. And this is what deep learning can bring to the table almost immediately. Now, I have to point out that this image I got from Wikipedia, and this is the source. Now, neural networks, to recap, neural networks are many layers that mimic the brain function. They mimic your brain function. It's like a senior physician integrating multiple subtle cues. And this could include medical imaging, convolutional neural networks, patient monitoring through recurrent neural networks, and of course, genomics also gets into the picture over here. Now, the future of AI involving and combining all of these approaches. It could be supervised learning, it could be unsupervised learning, it could be deep learning, and this aim is to provide clinicians with the information, the right cues to make the right decisions for better patient outcomes. Now, let's address the critical question that is probably on everybody's minds. How does this matter for you in your career, and what are the implications of this growing gap in healthcare AI literacy? There are people who are beginning to learn about AI and how it actually operates, and then there are those who are not. And as we talked about previously, if you follow me, that AI will not replace physicians. It will replace a physician that does not use AI. It could be an administrator, it could be a nurse, it could be a whole source of people who are not playing with the times. So that's why we are here, and that's why we are on this presentation. So why does this matter for your career? Now, let's say, for example, you are on this left side over here. So if you are only somebody who uses AI tools, you are just an AI end user, you will have basic tool usage, you will have limited growth, you will be just following protocols, you will have a reactive approach, you will have job insecurity, your salary may stagnate, and you might run the risk of being replaced by AI. And you have no strategic input if you don't know this information. If you, for example, are a physician and you know about AI, you are an AI decision maker. You may go into leadership roles. You may have a role in strategic implementation, AI system design. You will have proactive innovation approaches that you will implement yourself. You will have career advancements, salary growth. You will be leading AI teams and shaping the future of healthcare. And you need to know, that's why we are doing this, to understand how AI works. And so the gap will be widening between those who lead AI implementation and those who are bypassed by it. So be the decision makers and not just the end users. This chart over here tells the story of the explosive growth of AI healthcare, both in healthcare organizations that are using AI and how much money is being invested in the market. Now you are looking at two lines over here. The blue line, is AI adoption, okay, and the red line is the market size. Now over here is 2020, and this data is coming from 2024. So if we follow the blue line, the percentage of healthcare organizations using AI tools was around 15%. Now in 2024, this has gone up to 75%. Now you can see the trend is increasing and you don't want to be left behind. In simple terms, AI went from being used by 1 in 7 healthcare organizations to 7 out of 10 healthcare organizations in just 4 years. Now the red line is describing how much money is being spent on healthcare AI globally in billions of dollars. Now, starting point in 2020, this was around 4.9 billion. Now, currently, this has increased to around 22.5 billion end of 2024. Now, the future projection, it is going to go beyond 36 billion. That's a billion with a B. All right, so 36 billion. Now, in these 4 years, in simple terms, the amount of money being spent on healthcare has increased by more than 4 times, and it is going to exponentially increase. Now, if we go back over here, this is looking a little bit like a hockey stick. You know, a hockey stick goes straight and then goes up. This is what is going to be happening. It is going to be going up like a hockey stick. This is my impression of a hockey stick. So it's straight, then it has a curve going up. So this is going to be happening with healthcare. And the reality is that there are organizations and individuals who are investing in AI technologies or learning about AI technologies for themselves will be the future institutions going down the years. And those who are learning about healthcare AI and understanding the nitty-gritty and the details of this are going to be the future leaders. Now, in the next session, we are going to talk about data in AI and ML. So I want you guys to remember a quote that I don't know if anybody else said it, but I think is very pertinent over here. If you don't understand data in healthcare, you don't understand AI in healthcare. And there are different types of data. There's the EHR data, the medical image data, genomics data, variable data, and clinical notes. And of course, there are other types of data that are not listed in the EMR. For example, the environment, the calendar, what events are happening, all of those things do affect medicine. All right. Anyways, hopefully this was very informative, and I'm happy that you've taken the first step in your AI literacy journey here with myself, and I'm excited to continue exploring all of this with you. Thank you so much. Bye-bye.